Good afternoon, everyone. Happy Monday, snowy morning or afternoon. It's Maria Sanchez-Keene, and we are starting our seventh session on fundamentals and practical leadership for new and emerging leaders, improving outcomes. Evaluative thinking is a way of doing business. It is characterized of learning organizations. Let's begin. So one of the things that we believe is really important for new and emerging leaders is to really think about how you can ensure that the programs and services that you are running are making a difference, or how you can know more about them. And so this webinar really focuses in on that. Essential quality improvement and evaluation tools that will help you to ensure you are making a difference in the programs and services and initiatives that you are involved in. So we know that funders require this. It's very important for them to know the impact that you're making, that your team really wants to know what difference you're making. Your organization wants to know. If you have donors, they want to know that the programs that you're running really are making a difference in the lives of the people that you serve. And so the focus for today is really thinking about evaluation basics. And in an hour webinar, there's so much, as with every other topic, there's so much that we can say. We felt that it was really important to focus primarily on giving you tools. So there's one specific tool that we're going to walk you through for all of today that we think might be really beneficial for you to have in your toolkit as you think about how you can do an evaluation for some of the programs that you work on. So very quickly, ways to participate in a webinar. As you know, we have the chat, raising hands, we have the Q&A. We will be doing some interactive polls like we have in the past. We invite you to always be present, to come back to the Zoom camera if you lose your way. And as you know, the session is also recorded. So we're going to start with a quick poll. So to start that, I'll ask you to put your name in the chat. It's also a good way for us to get a sense of who is here. So if you can find your chat and put your name in it, that would be great. Thank you. Good morning. See lots of you there. Sarah, Melanie, Amanda, Pam, Sue, Sarah again. Keep going. Thank you. Okay, Steve. See you. Roberta. Great. Stacy. Thank you. So I'll ask Kathleen, if you could, Kathleen, just put the polls link as we have in the past. I'll ask you to put it in again, Kathleen, and just as other people are coming. Thank you. So you're going to go to the poll, and two really quick questions to start our work off today. So we're going to activate it and present it. From your experience, what makes for an effective evaluation? So what are the things and components that you think are really critical? Positive feedback. Okay. Thank you. Rating scales. Discussion from both sides, the use of data. All parties good, yep, included in the evaluation, that it's timely. Oh my gosh, that's huge. A good sample. Learning opportunities. Customer feedback. Yes, a balanced approach. Follow-up. Making sure that it's meaningful, that you think about how you're presenting, like such a thing as body language. Nothing should be a surprise. Isn't that interesting? A warm and welcoming approach, particularly from the people who are participating. Thank you. An opportunity for constructive feedback. Yes. Yes, they are about learning opportunities, having objective criteria, specific measurements versus just goals. Yes. Looking at statistics, positive feedback, growth feedback, and staff productivity rate. That's interesting. Thank you. Yeah, so there's a lot of different components that you're naming here. Having SMART goals, accessible to all in terms of many different formats of how you're going to do it. Having a good framework to collect the data for evaluation. That it's balanced, a balanced approach. So lots of good things. Thank you so much. That's a lot of what we're going to be talking about today, includes many of the things that you've named here. Second quick question for you this morning. From your experience, where does evaluation often fall short? Your thoughts? Leading questions. Yeah. Follow through. Not being open to negative responses. Yeah, not enough planning from the outset around evaluating. Today, Gerda Zonruder, who is senior researcher with us, who's got extraordinary and lots of lived experience working in the field of evaluation for many years, will talk about many of these pieces that you're talking about. And a really good one there, individuals being afraid to be honest. Yeah. Being not open to negative responses. Yeah, evaluation is not specific enough. Following through with suggestions after evaluation. You're right, a good evaluation will produce recommendations, and what do we do with those? Making sure it's done in a timely way. Having a standard format, formality of report out, written, not just verbal, so you have something to look back at. Yes. Consistently doing it. Yeah. There's a lot, there's a lot of things that a good evaluation, as we'll talk about today, should include. And sometimes a big challenge that we have in our organizations is time to do these pieces that you've talked about here. So hopefully we'll give you some tools today to help you with how you put a comprehensive evaluation in place. So thank you for that. So we're going to return to our screen. You should be able to see my slides. Look for the Zoom button if you don't, and if you can't, just put it in the chat and Kathleen will guide you to get back to here. So what is evaluation? And again, you'll have these slides that might help you. So it's a systematic process of collecting information for a specific purpose and use. It's often action-oriented, or it comes out of that. A tool to help organizations make decisions and to take appropriate action. And then evaluations can be simple reflections on how a program went to a comprehensive research project. So there's so much that's covered under that idea of evaluation. But here's a simple video that we think you might find helpful to kind of synthesize in a very simple way what evaluation should be talking about. So let me just share that with you. And we'll start it here. Go there.
So when people ask me what I do for a living, I usually say that I try to help organizations answer 3 questions. What, so what, and now what? So the what question really goes to, what is an organization doing? What are they putting out into the world? The so what question goes to, so what does it all mean? So we're doing all of this work. Is it actually making the world a better place? Is anything actually happening? Are we creating a better world because of it? And then I go to the now what question, which is, now we have all this information, what can we do about it? So how does an organization go from good to great based on the information that I can give them? So that's how I tend to describe things to people in a very simplistic kind of way.
Okay. So we'll stop there, but really keep in mind the framework that he's giving us there. If you're going to be thinking about evaluation in a simple way, it was, what did you do? So what difference did it make? And now what do we do with the information? So why is evaluation important? Because it is about program improvement and learning. That's fundamental to evaluation. And that's in some ways how it differs from research, is that it allows us to really look at things on an ongoing basis. We don't have to have all of those comprehensive things that research might need in order for us to improve and learn. So it should be ongoing and should be informing us, and it allows us to shift things to continue to meet the needs of the mandate and the objective and description of the program. Obviously, it's about accountability to funders. It is about prioritizing resources. So we've worked with organizations that have really expanded programs over the years, or they've done things for 15 years or 10 years, and they just do it because it's the thing that they've always done. But now they're really looking at things and asking themselves, should we continue to do that program? Is there a better way of using the resources? Are we actually reaching the audience that we said we were going to reach? So sometimes it's about prioritizing resources and how you're going to use them. Help determine the case for a program is a really good way to do an evaluation. So we often do a demonstration project or a pilot to say, we're going to try this out and see if it actually makes a difference, and therefore we can make a case for moving the program forward. Provide credible information to share with your board, committees, participants, and clients. And I would add to that even donors. So a lot of people want to donate to causes where they know that this is going to make a difference in the lives of people. So the more information that you have to be able to say, here's what we did and here's the difference that it made, the better off you are. Learn what needs to be done to make your program stronger. And that is that piece that you were talking about, is ensuring that we're able to take critical information and being able to implement that. And hopefully the outcomes will be stronger because measuring results actually does help us produce the results that we want. So with that, I'm going to turn it over to Gerda, my colleague, and she will continue to talk a little bit about evaluation. So to you, Gerda.
Thanks, Maria. And hello, everyone. It's really great to be here. The type of information that is needed really determines the kind of evaluation or the approach to the evaluation that you're going to use. This slide shows 5 different evaluation types and approaches, and it also explains what it is that evaluation would be doing. So for example, research, you're looking for answers to questions to get new knowledge. Process evaluation in the blue puck there, it explores how a program or initiative is making progress. It also looks at what's happening in the program. Your impact evaluation, you often see that also labeled as an outcome evaluation. What's changing? What are the longer term effects of an evaluation? So these are just 5 of the different labels that you might see. There are lots of other labels that might show up. So there are really many different ways to frame the evaluation process. Essentially, whether it's a 10-step process or a 10-step framework or a 3-phase process, the elements are really the same. In the remainder of the time that we have, we're going to go through the steps that are shown in this framework with a real focus on the focus, plan, collect, and analyze steps. And each of these, what we're going to do is walk through some examples, and we're also going to provide you with some tools, as well as some links to some additional tools for even more in-depth use. So some keys to remember when you're doing an evaluation is that it's iterative. You can't just put together an evaluation plan at the beginning and then not change it. It's going to change along the way. It's not cookie cutter. It's an art. So although we're going to give you some tools and it seems like, okay, here's how you do it, really this is just the starting point. It's a good foundation. It doesn't have to be expensive, complicated, or time consuming. You're going to make the evaluation fit the project. So, and also the information that you need, the decision that you're going to make. Some evaluation is generally better than none. And it really should be an honest examination of the program. So coming back to some of the things that you said at the beginning as to what makes for an effective evaluation. So it's not just about the good and not just about the successes, but it's also looking at the things that really, where can we make a difference? Where can we improve? And another really important thing to keep in mind as you're thinking about the evaluation is that there are some real world challenges. So it all looks great on paper when you put it down and you think, okay, we've got a great plan, but then there are other things that are going to come up. Things like resistance. Some people are really nervous about evaluation. There's misuse. There are cultural considerations, and actually as well, there's using a trauma-informed and inclusive lens with evaluation. There's also the context in which the evaluation is being done. So you may have a great evaluation and a great evaluation plan, but if the context isn't quite right for it, maybe hold off a bit, or maybe shift what it is you're thinking of doing. So back to you, Maria.
Thanks, Gerda. So let's look at what it is that we're going to be doing. As Gerda mentioned, because we were trying to really get it down to a tool that you could use, what we're going to do is we're going to provide one. So if you go to your chat, I'm going to put a link there, and this is also going to be where you see the slides and get information about your assignments and all of that. But for now, you can go into this link. And if you'd like to, you can download it. And our hope is that as we go through the example, you'll be able to have a Word document there if you want to write notes, or if you want to give examples of, have examples of what it is that you might do as you're thinking about an evaluation. You might be able to take notes there as well. So hopefully you can grab that link there if it's helpful to you, and we'll go from there. So as you'll see in the handout, a really important thing to do is just to do some basic information right at the top. That template will provide you, what program is being evaluated, what is being evaluated, because there's a lot of different things. As Gerda mentioned, there's different ways in terms of evaluation. So you want to get a sense of what it is that you're evaluating, what needs to be taken into account. And Gerda mentioned some things, for example, what does it mean to have an EDI approach, a trauma-informed approach, safety for the people, literacy levels. There's some things that sometimes we really need to take into account. Other things such as, do we need to provide child minding as we go forward? Will we need to give a token of appreciation for the people that participate? Does that taint it in any way? So all of those things are things that you need to be taken into account. And who's the audience and what are they looking for? The audience of the evaluation, and what is it that is most important for them as you go through the evaluation. And following that, you'll see in the document that there's a piece around stakeholder analysis. And we really want you to think about who are the different stakeholders that need to be included in the evaluation. And so as we go through this, we're going to be using a specific example, and then I'll talk about the stakeholders. In fact, I'll just talk about the stakeholders for a moment. I'll come back to the example. So the stakeholders are often people who have a vested interest in the evaluation results. So for example, this could include beneficiaries, participants, or those who are affected by the program, those involved in the operations of the program, so staff, and those who use the evaluation results. And again, that might be someone in your fund development team. It might be a funder. It might be the board. It might be someone who wants to do some communication about the value of the program within your organization. So you really want to think about all of the different audiences. And so again, to go through this example, we are going to, or the use of the template, we're going to go through an example. And the example that we're going to use is the Right Clinic. And we sought permission to do this. And this is an evaluation that Gerda is leading. So to give you some context, the Right Clinic is a not-for-profit community-based dental clinic that opened in January of 2021. Its mission is to provide accessible dental care to Londoners facing barriers, including those with housing insecurity and low income. Its vision is a community where everyone has the right to optimal oral health and well-being. The clinic has received funding from many different sources, including funding bodies and donors. The clinic is run by staff and supported with volunteer dentists. So it's really an exciting project that's happening now. And because Gerda has been able to be right at the beginning involved in evaluation, we thought that this would be a good example to provide you as we go forward today. So I'll run through here. And so if you think about that example then of the Right Clinic, one group of stakeholders who are the evaluation stakeholders would be clients. So the question is, how might they be involved and what will they do? So we would want them to provide input in terms of their experience. Obviously, we want to know, what's the service like for you? Was it accessible? Was it what you were expecting? Was it timely for you? What was the intake process like? Was it what you were hoping for? All of those questions. And then what might they be interested in learning from the evaluation? So if they're providing feedback, they might then ask, well, what changed because of the feedback I provided? And so we know, and we'll talk about this in later on, that people who are involved in evaluation also need to hear back of what happened with the evaluation and the results of it. And then what do we need to do to get them involved and keep them engaged during the evaluation? And so we want to be sure that they're informed about the evaluation. Also, that we're really clear on the boundaries. So often we hear, and we saw it in your information, that people are nervous about providing negative or constructive feedback because they think they might lose the service if they do, or they might somehow be reprimanded. So we want to be sure that we create really safe environments and help people understand that it's voluntary and seek their consent before you move forward, particularly when we're talking about the people who receive the service, and especially if they're vulnerable or marginalized in any way. what I like to do is ask you in the chat, if you could just give me examples from that dental clinic, examples of other stakeholders who might be a part of the evaluation. You can just put it in the chat so we won't go back and forth. Yep, funders, absolutely. Yeah, funders, a huge one. Staff, yeah, second really important group. Someone said volunteers, absolutely. The dentists themselves, what a great insight there, right? If dentists are volunteering, they're going to want to know that they're making a difference. So the evaluation focusing on them as well. You've named some of the really important ones. Insurance, oh, that's interesting, yeah. And particularly if you're thinking about making a case for this being more broad, you might want to think about that audience, community partners, board of directors, yeah, those who refer clients, yeah, you've named them some really important ones there. Thank you. Other social service providers to know about the service. Thank you. So you're thinking appropriately about the people that you'd want to be really mindful of, and having that list. It doesn't mean that they're all going to be included in the evaluation, but they will help you as you develop the evaluation. Ministry of Health, thank you for that example. So I'll turn it back to you, Gerda.
Thanks, Maria. So as you had noted in the earlier, having a good plan really is important in the evaluation, and having a good plan starts with really understanding and being able to describe your program. This is, it's what is it your program is trying to do and why? What changes do you expect to see? So, and you're going to use your description to analyze how realistic your outcomes are based on the activities and the resources. So, you know, it's a really good way to test. Okay, this is what we are doing. This is what we want to do. This is what we want to see change. Does it make sense given, is it reasonable and logical? And starting with a table like this helps you to create a logic model and evaluation indicators. So this is a really important place to start. This is a template that we have found to be really helpful in developing the description. And so whoops, if I could, thank you. So
sorry.
No problem. So what need is the program addressing? So many people who don't have access due to barriers, and that's not just affordability barriers. Who's the target group? And so if you could click to the next one. So adults living in London and Middlesex. What are the things that the program is doing? So actually thinking through what exactly are we doing? We're not just doing dental appointments. Yes, that's really important, but there's other things that we're doing. What do we expect to see? Well, we expect to see clients coming to the clinic. That begs the question, how often do we want to see them come? Is it just once? Is it multiple times? We're going to see community partners engaged in referring clients and so on. What outcomes do we expect to see? Well, there's, of course, outcomes for the people. They want to see that their oral health is improved. But what else? We might want to see that there's reduced use of emergency hospital visits for the system. And what does it take to actually do this? So this is a tool that is in your handout, and we have found that people can actually really, come to grips with what it is they're trying to do. Okay, so we can go to the next slide. To focus your evaluation, it's really important to be clear about the purpose. So what's it going to be used for? What decisions will be made? What do you need to learn? Maybe you want to learn about how the program is being implemented, the processes for improvement. Maybe you want to learn about the impact of the program for stop-go decisions. So if you could click. So in our example, the board wants to use this evaluation to learn about the effectiveness of the clinic. And ultimately, they want to know whether or not the program should be scaled. So we started with a process focus. We wanted to look at how effective the clinic was at reaching its target group. And we designed the evaluation as well to focus on the key outcomes. So if you click the process focus, who does the clinic actually serve? How does it compare to the targeted population? Outcome focus. What results or effects, what changed? So the evaluation questions that line up with the outcome focus. What are the health and well-being outcomes for clients? What impact has it had on the health system? Is it actually diverting people from going to emergency? Because that was a really important outcome for many of the dentists who were, and the dentists who were involved in actually getting this clinic going. At the bottom, you'll see there's a bunch of tips from the field about prioritizing questions. So you could come up with a whole whack of questions. Really what you want to do is narrow it down to maybe 5 to 10. When you're asking process questions or focusing on processes, you might have leaned towards more questions, like 10 or so. And if you're looking at outcomes, you might lean towards 5 or so. And then within that, of course, there will be a number of sub-questions, but really try not to ask too many questions because it gets just to be too much. So if we move to the next slide. So now you're going to start planning. Now that we've decided what it is we're going to ask, what we want to know, and we've got a good understanding of our program and everybody's on the same page as to what it is they're hoping to do and hoping to change, we're going to say, well, how are we going to actually answer those questions? Before we get into some of the details, I want to just take a quick review of output, outcomes, and indicators. So this slide provides you with some definitions, trying to make the distinction between the output, a clear statement of the immediate result of an activity or project, an outcome is a clear statement of the targeted change, and the indicator is the measurement of it. So this little cartoon here, looking at the comic, saying boo is an output, striking fear in someone's heart is an outcome, but the number of times you said boo and the number of people who said that hearing boo struck fear in their hearts are the indicators. Measures or indicators can be qualitative, like narratives, and quantitative, numbers. And I think one of the things that we often hear is that it's really hard when you have qualitative to actually do an evaluation. What's tangible and what's not tangible. And often when we have things that we think are not tangible, if we actually think down, what is it makes us say somebody is empowered? We can start to actually figure out what are some of the things that tell us that someone is empowered. So there are ways to take that qualitative stuff and really get more and more closer to what the indicators would be that tell you empowerment is happening. So we go to the next slide. So this is a template. This is a template that we have found to be helpful in not just identifying the indicators, but also determining how to get them. So what we do is you start with your evaluation question. What's the question that you really want to focus on? And then you're going to identify what are the things that we're going to use to measure those. So if you can click on that. Oh, wait, yeah, click on the first one. So using the chat again, what I'd like you to do or invite you to do is to identify some of the indicators that would answer this question. What would you collect? Where would you get the information? So use the chat and just throw some things in there. So we've got an employee survey. That would be a way to collect things, yeah. Survey the client satisfaction survey, number of attendees. How many people receive dental care? Yeah. Customer survey, ways to catch it. So seeing a couple of surveys. How many people? How would you get, complaints? That's good, yeah. Okay, so here's what we did. Anonymous surveys, interesting, yeah, whether you do it anonymous or confidential. Suggestion box. So here's what we're doing, Maria. So we're looking at the indicator is the number of clients who access the clinic at least once. And we also want to know who are they? What's the client profile? So the data that we're collecting are the names and some demographics. And where we're getting it from is from registration forms, which then get fed into clinic records and reports. And as a little side note, this sounds really simple, but one of the things we realized is that the forms that you use in dental clinics for capturing information, they get scanned and uploaded. And so it's not actually really easy to extract some of those client demographic information that we thought was going to be really easy to grab. So when you're putting together your evaluation and you're looking at your data sources, you're needing to think about, if we have this data, how are we going to get it? How easy is it to get it? And what do we need to think about in order to make it easy to get? So if you're collecting manually, are you going to have somebody input that information? How are you going to work with it? So in the bottom here, you'll see there are some tips again about indicators, and some questions that help you determine the measurable indicators. Again, looking at what would be a success is also a good one. All right, so we can go to the next one. Yes, it's another table, another template table. Evaluation's full of it. So this table takes you one step further. So now we're into the collecting data phase. And it takes you one step further in your evaluation design. It's how will you collect the data, from whom, when, what steps do you need to take to make it happen, and what will you do with the data when you get it? So if one of our indicators is percent of clients with improved health. So here we're measuring, are we successful, or is the clinics effective at improving client health? And our indicators is percent of clients with improved health. What we did, so what I'm going to actually, before we click on that, from our example, using the chat, how would you collect that data? How would you answer that question for the percent of clients with improved health? Survey. Charts, yeah. Number of return visits, yeah. Pre-post, that's great. Yeah, looking at that pre-post is good. From dental appointment visit results, yeah. How we gather to the phone and other means or other means, yes. So Shaquille, do you mean with that phone is the actual instrument, whether you do it by a paper survey or an online survey or a phone interview? Is that kind of what you're talking about with that? Yeah, okay, thanks. Appreciate that. So here's what we have done or are doing. We are doing a client survey, including pre-post questions. We're doing it online and hard copy. And the clinic opened in January, and there's a funder report due in the following January. So we thought November would be a good time to do it, because December is busy, and January you want some time to have a bit of, in case we don't get enough responses in November. Clinic staff are helping with the distribution by text, email, and in office. So, and thinking about that was really helpful. They've been really great at making that happen. With the implementation steps, so what we needed to do was we actually needed to design the survey. So we did a literature review, especially because we're looking at improved health. We weren't just looking at dental health, because the theory of the program is that if you improve dental health, oral health, it's not just about your mouth. It's also about how you are, how you feel about yourself, how your quality of life. So there, we did a literature review to look at sort of a broader definition of health beyond oral health. And then you pilot test the survey. One of the things when you're adding pre-post questions is often, if you're doing like after the fact pre-post, which is, there's good research to support that, is that you're doubling your questions. So, doing a pilot test to say many questions do we have in here? How long does it take to actually answer it? Are there any questions that don't make sense? And then we administer and monitor for responses. So how are we doing? When do we send out reminders? How often do we send out reminders? And what kind of responses are we getting? Are we finding that people are opening the survey and then they're just dropping off and not actually completing the survey? So these are sort of the things that you do as you're going along. Beforehand, or one of the pieces as well that we needed to really think about was, how are we actually going to get this survey out to people? So this comes back to the data. What kind of records do you have about clients? What we had assumed we would do was we would just email to everybody, because there's a spot in the tracking tool for people to put their email address. What we ended up finding was that out of about 400 clients, 50 records, there was actually 50 email addresses that were readily available. And so we needed to do some work to actually create a list where we could send it out to people who had attended the clinic. And then we thought about, well, what do we want to do? So we want to compare the pre-post test scores on some of the questions. And of course, we're going to do some thematic analysis of the feedback on client experience. And when you think about this stuff beforehand rather than at the end, you'll also get realistic about, well, what's it actually going to take? So if I have 10 open-ended questions that ask for a lot of information, that's a lot of work to analyze. And so it really starts getting you thinking about, what do we really, really need to know, and what can we let go of? So back to you.
Thank you. So as Gerda is talking, I'm thinking about examples where Gerda and I have worked together, and we start out with so many questions that we think we need to ask, and realize along the way that there's no way that we could ask all those questions, and we have to keep whittling it down and getting it down to the fundamental questions. And I'm sure all of you have experienced the survey fatigue that is going on. So selecting the questions and then really thinking about, are those questions going to get us where we need to go, is really important. So I think from what Gerda is sharing, you can see that evaluation, to do it effectively, isn't something that you add on at the end. And often, in fact, we're called in at that point. We're called in to say, well, we did the program, now we want to evaluate it. And what we find is that when it hasn't been thought through all the way, going back to get the information becomes really difficult because we haven't been mindful about how we have to collect data. So we've sometimes had to go into records that have been really hard to go back into because we haven't systematically collected all the information. So if there's one thing I would say that we hope that you will get out of today, is that evaluation needs to be done all the way through. At least you're mindful thinking. And if you're thinking, I didn't do that, that's okay. Start soon to be thinking about, what is it that we want to be evaluating, and are we collecting the information that we need to be able to move forward? So in the template that Gerda is referring to, and hopefully you're able to see it in the link that we provided, and again, it will be on our site for you to access as well. At the end of it, you'll see this evaluation matrix. And really what we hope to do here is be able to provide kind of a one-pager where it synthesizes all that information so that you're able to look at it carefully and figure out what you need to be doing related to evaluation. So again, this is just one example. There's many out there, but you'll see that here you'll have, okay, what are the evaluation questions that we're looking at? What are the indicators that we need to be mindful of? How are we going to be collecting that data? And again, this is where it gets hard, because we can actually do the evaluation questions and the indicators. But when we start thinking about how are we going to systematize the data collection, it's that piece where we sometimes even get as good as collecting the workshop survey information at the end of it, but then we don't do anything with it. So how are we going to collect the information so we can use it? What's your data source, which is, are you doing, as some people mentioned, are you doing a file audit? Are you speaking to people? Are you doing a pre-post? Who is it? Or how are you going to get that information? What's your methodology? Goes into, is it a survey, or are you doing an interview, or those pieces? Whose responsibility is it? and what's the timing? I find when we get to this point here, this is really important because are we asking a administrative assistant to assist us with this? Is it a program and services person? Is it the coordinator's perspective? Are you asking a volunteer? Getting it down to who's going to be responsible for that information is really important to make this actionable moving forward. And then as Gerda talked about, the analysis plan, which again, what we find is as you go through the evaluation matrix, it gets harder and harder to complete. So sometimes by the time we get to the analysis plan, as I was mentioning, people have the information, they've just not pulled it together. So we've gathered it, but we've actually not looked at what clients are saying. We've actually not summarized the staff satisfaction survey. We have collected information from community partners, but we haven't done that work. And it's really no one's fault. It's that there's so much to do in everyday people's lives. So the clearer we get to whose responsibility is, the timing of it, it will touch into this idea of the analysis plan. So being sure that you are collecting the right information for the right audience, trying to keep it as simple as you can so that you're able to use the data moving forward, which of course is why quality improvement is such a good way to do it, because it's this incremental information that you get along the way that you can adjust as you go forward. The challenge sometimes with that is that sometimes it doesn't tell the full story and it doesn't give us that outcome data that is so important. So being really clear at the beginning, why am I doing this? Who is this for? And what am I hoping to get out of it is really valuable and important. So you'll see there one tool, again, just to synthesize everything and get it to the point of being able to say who's going to be responsible for doing what pieces of it. We hope that's another good tool for you. So you'll see here, just to run through the example, what is the participant's experience with the program? So we wanted the indicators as program strengths and weaknesses. The data collection is participants' feedback. That's going to talk about location, schedule, content, and overall quality. We hope to get it from all program participants, including those who have left the program. And that's so critical right there. And this is very hard to do, getting those who left the program or getting those who didn't get to access. But if there is a way for you to follow up with those individuals, often they can give you information that is really essential for you to know. So it's particularly if you've noticed a big dropout rate, or you notice that some people, there's maybe a trend that you're seeing that after X number of sessions, people tend to drop out. That's a really important piece of information for you to be able to adjust your program. So the collection methodology is going to be interviews with a small sample of people and surveys of participants from the year before. It's going to be the evaluator. And again, sometimes you don't have the luxury of an evaluator. So being able to say, okay, who's going to assist us? In this case, of course, they have Gerda. Design and pilot the instrument and then administer it in May and June. And then you want to do a thematic analysis of interviews, open-ended surveys, and the summary of survey results. One question as you're going through today that you might think is, I don't have all the resources. So part of it might be, where do I pull an evaluator to assist? And sometimes that's at the beginning to help you design, to help you understand, design the tools. And then you and your team collect the data, and then perhaps checking in with an evaluator to say, are we still doing this okay? And then at the end to help you analyze. We find again that analysis piece is hard to do for people. So if you're thinking about where do I resource this, that's a place at the beginning to be sure you've got it all right. A check-in to make sure it's going the way it needs to go. And at the end to help you pull those themes together. So in terms of analyzing, so moving to that place now, you've collected, you've got the results. How do I actually analyze this? So first of all, just ensure that the data is organized and clean. So this happens to us all the time. We get 400 hits and we might think, oh, good, we got 400 survey results. But in fact, we might have 100, because we know that people hit on the link, start with questions 1 and 2, and then just go, I don't have time. This isn't what I thought it was. So just make sure that your information is organized and cleaned. Make sure that you have a good plan of how you're going to analyze the data. And again, this may not be something that you do regularly, and you might need some support analyzing qualitative data analysis. Gerda does, and Kathleen does a lot of work, and there's a lot to that. So you might be able to have some assistance there. Interpret and draw conclusions, and this is so big. And I will say that what we have found in our work is that we do it in a team setting. So often after we've analyzed the data, we call a hive in our team. We call our team together and say, what are you seeing in the data? What are you seeing? I'll give you the example. We did the Student Resource Officer Program Review, which is policing in school. We had over 2,000 people when we organized and cleaned the data that had responded to it. There were 4 researchers that worked on this program, and they were doing literally thousands of coding of information. And Kathleen and Gerda were instrumental in this work. But once you are into the data for that length of time, it's really hard. And so it's really important to be able to say, okay, let's just step back a little bit. Let's pull our team together and ask ourselves, what are we seeing in the information? So don't be afraid to do that. Once you've analyzed the data, to pull your team together and say, so what? What is this saying to us? Going back to those simple what, so what, now what do we do with it? Which then helps you to draw conclusions and recommendations. And of course, really document your limitations. That might be that you weren't able to get everybody from last year, that there were issues of literacy and interpretation, that maybe it wasn't as timely as you imagined it to be. So it's important to set the context of the evaluation as well. One other thing that I'll say is that at this point that we often overshoot on what we can do with evaluation. We make our plan too big, and that happens with our programs as well. So you might say, I went to a funder and I told them I was going to change the world with this 8-hour program for girls. And now you have to evaluate it. So be really sure that in your program description and what you're saying the program can do really matches with the resources and the time that you have with people, so that you don't overshoot on what it is the impact is going to be, because eventually you're going to have to evaluate that. And if you overpromise at the beginning of what that is going to do, it's going to show at the end. So be really, really mindful that the outcome of your program should be in direct relation to the resources that you have committed, the amount of time that you have in front of people, and the change that might be possible because of what you're doing. So you might be able to say, I contributed towards something. I inched something towards that change theory. But to actually say that it's going to all come because I spent 8 hours with a group of teenagers may not be the way to go. So be really mindful at that end, because it's going to impact your evaluation at the other end. Though I always think we can change the world, and I put way too much emphasis on that as we go forward in most programs. And so then I have to come back and circle around to make sure that that was okay. There's some other resources that you'll have here as well to help you with that and be able to move it forward. So then, of course, it comes to how do we actually communicate what's happened here? So you have to always think, who's my target audience? What information do I need to share? And just because we collected in that example that I shared with you at the SRO, thousands of responses and thousands of coded information, and then getting it down to a whittled a report, what actually went out was a lot simpler, which, sometimes came down to thousands of things being down to a check mark, which was very difficult sometimes to see, but important for us to know who's the audience and what do they need to know. What's the most appropriate method of communication? And it doesn't always have to be a lengthy report. Gerda will give you some examples of one that isn't. And deliver and present findings and recommendations. So this is really important, that after you do the evaluation, you're able to think about who you were doing it for and how it is that you're going to get to speak to them to be able to tell your story. And this goes back to some of the work that we did in other webinars where we talked a little bit about making sure that you are an advocate for your team and that you're communicating the successes of your team. And evaluation is a really solid way to do that. And even if it's not all positive, which evaluation typically isn't, it gives people an opportunity to see you as a leader that takes the work seriously and has a plan on how to mitigate and make it better. So with that, though, we aren't all really great report writers. And again, it comes back to a time factor that we may not be able to put it all together the way that we want to. So there are ways that you can still present your results without taking hours and hours to do so. So I'm going to turn it back to Gerda, because this is one of the things that she's so good at, being able to get it down to a wonderful little spreadsheet here. So I'll turn it to you, or a scorecard.
Thanks, Maria. So this is an example report that we provide to the board of the Right Clinic on a monthly basis during the first year of operations. And in fact, the very first one we did was in March of the year. So there was really very little. And it was like really basic. How many people did we see and how many appointments did we do kind of thing. But what we found was it was really helpful with the board who really hadn't had much experience in this area yet, to start to get intimate with what's going on at the clinic. This particular dashboard took a little bit of time to get set up, but now that there's a template, it's something that the goal is that it will be able to be updated maybe quarterly, and it can be updated by staff who are there. The dashboard report has been used by the board to report to their funders. And what's really great is that it made reporting a lot easier because they have quite a few funders and different funding schedules and different metrics. And so this is actually a way to try to make it easy for the clinic to be able to have some consistent reporting in a way that funders will say, yeah, this is credible. I like working with this. We're using Excel to create this report, so it doesn't have to be anything fancy even to do that. Okay, so we can go to the next slide. So when we share this kind of a report or another one, you're going back to the stakeholders. So whether that be the staff, whether that be volunteers, whether that be participants in some cases, you're able to convey what did we learn from this evaluation, and here's what we think should happen. And sometimes, most of the time, people will go okay and move on with it, and many times people will say, but have you thought about this, have you thought about that, and then you get tweaks to your recommendations, which is really, really good. And from there you can develop an action plan. So there's a really useful resource again that we wanted to provide to you. It's use and share your evaluation findings. So this has, it's an online tool that you can go into and you can see, provide you a toolkit, templates along with the template that we have, but it's just another little resource that's quick to access. It's not a big textbook, quick to access, but to help you with using and sharing evaluation findings. So moving back to you, Maria.
Thank you, Gerda. So we just want to talk, and I realize now that I talked a little bit about this already, but how do you resource an evaluation? So on a budget, one of the things that is kind of a best practice is to be about 15% or even more around the evaluation budget. And again, one of you might be saying, I don't even have that in my budget to be able to allocate 15%. But it may be something for you to think about is when I put in a application or when I put budgets in for my organization, if I'm responsible, or even if I can just make a suggestion, you may just want to put a bit of resources in this idea of evaluation. We count on it. There's many people that want to see the results, but often many of you are doing it on the side of your desk and it becomes harder to do. So that is something for you to think about. In terms of whether or not you use an internal or an external evaluator, I guess I would say it really is about the resources that you have, but really be mindful if you don't have many resources, where can you bring someone in to assist you with those pieces that are maybe getting in the way of moving the process forward. Also, I know some of the organizations that are on here, and you have some extraordinary people who are internal to your organization that you can maybe turn to say, listen, this is the evaluation plan that I'm thinking about, or the quality improvement plan that I'm wanting to put into place. Can you just coach me or give me some advice on how I might do that? Of course, we're hoping that some of the tools that we're providing for you today might assist you in being able to do that. So really think about what is it that we want to evaluate? How might I go about using the template that we were talking about today? And if I have a bit of resources, how might I use them either with someone internally or bringing someone in just for a piece of it? Of course, we also work with organizations that have a bit of a budget to work with, and then we're able to do a more comprehensive evaluation. But the funding for it shouldn't stop you in being able to do some level of evaluation for programs that are important for your organization. The other thing I'll say here is that every program doesn't have to be evaluated every year or all the time. So sometimes we'll come in and do like a snapshot in time evaluation. We might say, let's take a 2-week window where we think things are more or less running the way they need to, and let's just take a snapshot of that moment to see how things are going. So again, evaluation isn't research, so you don't have to have all of those pieces in place, but of course you do want it to be able to say something about your program. So there are ways in which you can do it. You might say, you know, perhaps I'm responsible for 3 programs and I'm going to go into a deeper evaluation, 1 program per year. And that's how I'm going to really focus my evaluation dollars, for example. So there's different ways in which you can use evaluation dollars, use internal and external resources to at least be able to say something more specifically than just outputs about the programs that you're responsible for. So really, I think a big part of evaluation is creating a culture of evaluation. So making sure that we're just always thinking about the process, thinking about how we can improve it, and thinking about that idea of you know, what, so what, and now what as we go forward. And the now what being the big part of it. What does this data tell us about how we can improve, how we need to change things, whether we're reaching the right audience, whether we need to close the service, that this program or the service, and move into something else. Having a learning culture says this is all good to do. Nothing is forever, and things can shift and mold and change as we go forward. So it's really important to know that evaluation is at the center and not an add-on, as we talked about. That is more than a compliance activity. So it isn't just, I have to do this, so I better. Thinking about the information that you need to get. I know sometimes that the requirements that funders have aren't necessarily the most life-giving indicators that you want to collect. So sometimes we'll work with teams and say, okay, in addition to what you need to do with your funders, what is one thing that you want to learn about your program, your participants, the impact that this is having? Just focus in on that, but be thinking about that regularly. What is it that I want to learn? What does my team need to know about this program in order to keep it vibrant and alive and meeting the needs of people? So you'll read there a lot of different things about the evaluation culture, but a big thing is just always having it in your mind as the different pieces that we've talked about during the webinar series that are important for leaders to know. And so with that, we'll turn to those who are doing the certificate, the reflection questions. What we really want you to do is fill in the template. Use a program. So think about something within your organization that you think would be really valuable to evaluate, or that you're curious about, and complete the template. So identify the program, complete the basic program description in the template, and then in terms of the evaluation matrix, at least complete 1 question so that we could see that your methodology and your thinking is really clear on it. But we do hope that you'll be able to use it and be motivated to move forward with it as you think about evaluation. So thankfully, that isn't due till January 24th, so you'll have a nice break in between. And so the last thing that we want to do, as we often do, is just do a quick checkout. So I'll ask Kathleen to put the poll question in so that we get a sense of how helpful this was to you. So we'll go back to the polls. And the last question is 1 word to describe how you are leaving today. I don't know if that's hyperlinked there, Kathleen. Oh, I think you missed, let me try it again. You may have missed the H. Oh, there we go. There we go. Thank you. Informed, informative, data. Yes. Refresher. Awesome. Yeah, again, there's some of you that have this already in your background. Feel free to tell others so that they can tap into your wisdom. Intriguing, resource rich, and good. I'm glad. Thank you to Gerda for putting so much of that interest together. Interesting, I see there, Roberta. Challenged. Lots of tools. Good. Intriguing. Informed. Well, with that, we say thank you for joining us again. Hopefully, as you move into December, you're able to take some time for refreshment and rejuvenating as we move into the break. Thank you very much and have a good rest of your Monday. Take care. Bye-bye.